Okay, I am filling in for Dr. Hirsch. It's a real pleasure to welcome Dr. Shannon Udovic-Constant as today's Grand Round speaker. She's an alum of her own medical school as a JMP student and our pediatric residency program. And I had the tremendous pleasure of being in her residency class together, and a forever bonding experience. She's a leading pediatrician at the Permanente Medical Group here in San Francisco. And just a note, she's a mentor, champion, model, and coach for many women identifying physicians seeking leadership positions. She's a strong advocate for children's health, and she's the immediate past president of the California Medical Association. And I've since learned she's the fifth female identifying president of the California Medical Association since its inception, which was before the Civil War. Her extensive leadership experience also includes serving 12 years on the Permanente Medical Board and as president of the San Francisco Marin Medical Society. Today, she's bringing that high-level perspective to help us navigate the current legislative landscape and upcoming changes that will impact our clinical practice. So please join me in welcoming my good friend and colleague, Dr. Shannon Udovic-Constant.
Thank you so much for that lovely introduction. Yes, it's lovely to be back and see some familiar faces. And it's the first time actually in person in the auditorium here. I've joined a lot of your grand rounds virtually and very much enjoy it. So let's jump right in. So wanted to really share with you beyond the exam room, sort of policy updates and advocacy. And my goal is not only to inform you about some of the important policy pieces that are at play right now that will be impacting our ability to take care of our patients, but also to inspire you with some ways, both small and big, to weave advocacy into a busy pediatric life. I do not have any disclosures or any conflicts of interest today. And we just talked about this, but the objectives are to explain some of the recent federal as well as state legislative Medicaid actions that will be impactful for access to care for our patients, describe some implications of upcoming California state legislation on your own professional life and the medical care of our patients. And then again, identify some ways, both small and a little bigger, to get involved in community advocacy if you are not already. So gonna jump right in so we have enough time because I want to also engage in dialogue and questions with you all. So we all were incredibly saddened to watch HR 1 pass in the legislative session last year. This was despite very, very strong advocacy from the physician community, very much explaining the real life, real world impact that these cuts were going to have on our patients. I was president last year of the California Medical Association, and as this landed, I did not realize how much frequent flyer miles I would be getting on United Healthcare, driving back out, or on United Airlines, flying out to DC, meeting with our California Congress people. And as you all know, it was really important to inform some of our Republican Congress people to be able to have an impact in the outcome of this. And it was very sad because what we found in those rooms where they very much understood the impact this was going to have. And a lot of times it was going to have a larger impact in their own communities. And they understood that. And yet still we saw just straight party line votes. And it was disheartening to watch. And at the same time, I think really important for all of us to understand and engage even more to help our patients understand impacts that they have, the voting that they have on their own access to care. And I think that is an obligation of us. For a long time, we felt that we shouldn't engage in those conversations because it felt maybe not right. And I think the time has come for us to make sure that when we're asked about this, that we're honest about how some votes impact directly their ability to access care. So I'm sure you've heard a lot about this. I'm going to go at a very high level of HR1 cuts and coverage losses. This is from a statewide perspective, but we're looking at a 17% cut. That's $187 billion. It's looking to be 3.4 million Medi-Cal lives, as well as 400,000 of ACA enrollees who will lose their health coverage. In addition, right now, just because of the ACA tax cut subsidies that have not been approved, we're seeing impact this year, right now, on the numbers of ACA enrollees, as they are very much seeing an impact to the cost that they are going to be asked to pay for their Affordable Care Act insurance on the exchange. We also are going to see 3 million Medi-Cal enrollees potentially lose coverage due to work requirements, red tape. And this is about $22 billion in loss of federal funds in California. I have a little hope that we can impact this as advocates and as physicians. There is the ability to define at the state level who needs to go through those work requirements, and we're hoping to make that as broad or as narrow as possible, so that it impacts the fewest numbers of people to have to do that. But we're also in conversations about how do we partner in the work communities, chambers of commerce and such, in order to make it really easy for our patients to get the documentation that they need. And should we kind of be creating the ability to make it easy for our patients to upload those documents, as we know many of them do not have access to stable internet at home, or may not understand, how to scan a document and change it into a PDF and upload it into that file. And so we really just want to help our patients to not fall off their ability to engage in this insurance and impact their access just because of this regulatory burden. As you all know, as we're seeing play out right now, very sadly, watching the way that this country is looking at immigration, it is making it hard for California, who had made a lot of progress in this space, to allow for coverage through our Medicaid program for documented immigrants. And as of this year, they will be losing the ability to access care through the Medicaid and ACA programs. And then there's provider tax cuts as well. And so this will directly impact a lot of hospitals. We're already seeing several hospitals in parts of the state that are noticing that they are not planning to keep their doors open. And so there's some conversations happening at the state level about how do we engage in those communities and really make sure that access is appropriate, and we're not asking for drives to access to care that's really going to impact health and morbidity and mortality very negatively. And we already had problems around maternity deserts in the state, which very much affects us and our patients. And we all know that if a patient is not having the ability to deliver safely, sadly, things can go wrong, and we need that hospital care for our patients that need that. And then there's uncompensated care costs that are coming. That's $9.5 billion. And then the other piece that's really important that I think a lot of people lose sight of is that healthcare is a very large employer. And so not only is this important for a community in terms of jobs, but it's also important in terms of economic output, as well as local and community and state taxes. And so the ripple effect that this potentially will have is estimated to be about $37 billion. And I know these numbers just feel so big, and they are. And so just really looking at how can we really impact and decrease the risk of all of this. And the good news is some of these pieces won't be coming into play until later this year, or even in 27 or 28. So there's a little bit of time, and everyone is a bit hopeful about midterm elections. And I think, again, important to engage in that process for all of us. So this is coming on the heels of an incredible victory that California had. So in my role traveling around the state of California, I heard from many physicians that they wanted to be providing care for those on Medi-Cal, and yet they couldn't make ends meet. They couldn't pay their staff at their clinics. They couldn't pay their utility bills if they had too many patients on that line of service. And so the California Medical Association went out in partnership to go get the money to increase provider reimbursement rates. And it was so heartening because I was up at an event up in the northern part of the state, and a pediatrician who had one practice said, "I'm so excited. I actually can make ends meet, and I'm going to open up another pediatric practice up there in this area of our state that really had poor access to care for children." And then kind of all of this is coming. And the good news is that CMS has approved this managed care organization tax that was the funding mechanism for Prop 35. They've approved it through the end of the year, and then we will be working with everybody to see what types of adjustments will need to be made to try to keep it going. The state has been very slow in implementing this, despite this having very large voter support. And this was not a partisan issue. It's very interesting. Even our voters across the state who were not on Medicaid insurance themselves, they all knew someone who was, and they understood the direct impact it had on their ability to access care when they needed it. They understood that without a medical home and primary care access, that the emergency rooms, that if they had an emergency, were going to be overfilled and overcrowded, affecting their ability to access emergency services when they need it. And so this got 67% support up and down the state. There are not many initiatives in the state that win by that level of a victory. And it had not only investment in primary care, but also for some emergency services. And then important for all of us, especially here that are engaged in medical education, there was some GME funding as well. And those dollars are flowing, which is great. The emergency piece is moving, and the codes and kind of the logistics around the primary care billing is in active discussions. And I'm fingers crossed, hoping that's going to be flowing very soon. So shifting gears more to some of the state level for this coming year, this is a little glimpse of the hundreds of bills that the California Medical Association is engaged in. These are a few of our priority pieces of legislation. There's a bill that's really focused on public health. We're all seeing the e-bike injuries and knowing that that is not needed, and we can do some things to impact that. And so there is a piece of legislation that's looking at doing some regulatory pieces in there, focused mostly with the retailer and the manufacturers around disclosures and looking at having local control. There's already a few counties that have passed some stricter rules, especially for youth, and kind of banning some of the ability to use these. Some of the other approaches have been looking at making sure that the speed that they can go is controlled to limit the risk of injury and potentially death. There's also some legislation ongoing around prior authorization. This is a really big issue, and it's really important that when a physician decides that something is needed for our patients, that our insurance partners are going to pay for it. And I had a conversation with a colleague who's a pediatrician who was arguing, it's like 45 minutes at the end of a busy clinic day, arguing with somebody about getting authorization for an EpiPen for somebody who has a peanut allergy. This is something that is a standard of care. This is not anything that's going to be denied. And she's on the phone spelling anaphylaxis to somebody who's not in medicine. And so there's just been a big push around how do we get rid of those barriers so that we actually have the time to take care of our patients and that our patients can get what they need. And so this bill is looking, because then the other piece is that it happens, you finally go through all the hoops and you get the approval, and then it expires after 4 months. And so I'm married to a general surgeon, say there's difficulty, we're not in a system where we need prior authorization, but there are issues around access to operating rooms and being able to get your case scheduled. And so getting that case scheduled and then having, it's 5 months from now, and then having your prior authorization expire and start all over again. And this happens. So this legislation, AB 535, is to allow that approval be valid for a year. And so we're hoping that will pass easily. Something near and dear to my heart is physician health and wellness. California used to have a diversion program for our physicians in training who were struggling with either mental health or substance abuse issues, where it wasn't impacting their ability to take care of patients. It wasn't putting any patients at harm, and they could go for a confidential program. And as long as they followed the steps of this program, they could get the services and the help they needed, rehabilitate, and come back to practicing medicine. And unfortunately, due to some unfortunate events, and it wasn't really the way it was set up here in California, it really wasn't following some of the national best practices. It was embedded kind of in the medical board, which is not ideal because people don't necessarily want to go to that place to get some help because they're worried that there's going to be fallout on that. And so it had gone away, and ever since it went away, we've really been trying to get it back. And I am really pushing hard and doing a lot of work to try to get this back. And this program now would be endorsed by both the medical board and the California Medical Association and other important physician organizations that do a lot of work in this space to create a program. It's really important that we take care of our own. And as I traveled across the state last year, I heard from one physician who participated in the program before it went away, and he went on to, a 35-year career, and this was 15 years ago. And then another physician who told me that his wife had participated in this program, and same thing, and he credits it for saving her life. So when they look at kind of incidents from other programs that are in place across the country, sadly, there's probably a couple hundred physicians that are out there impacted that are not seeking help. I do want you all to know, and this is important, but there is protection in the way that we sign up for our medical license. And now the renewal questions do not ask whether or not you have participated in any mental health or have sought services for that. The question is really what needs to be known, which is, are there issues that impact your ability to take care of patients? So there is protection, and I encourage everyone to seek help. And if you know others, reach out and provide them with that reassurance. And then AI. So, gosh, you cannot open anything and not read about AI in healthcare right now. And I'm excited about it. I use a scribe for my outpatient pediatric practice. It saves me about an hour a day. And yes, I have to look it over and make sure there aren't things that are incorrect. But it has not only saved me time, but I enjoy my work more. I can sit and play peekaboo with that 7-month-old before I have to lay hands on him, and ideally kind of develop that rapport rather than sitting at the computer doing data entry. So I love it, and I think we also have to have some guardrails around it. We've heard about some issues related to deep fakes from some other physicians across the country, where they're on social media and their image and some of their voice even gets captured. And so we're really looking to put some guardrails around that and make sure that if that does happen, that there's some protection for all of us. All right. There we go. And then the last thing I wanted to share about some of the state issues is the Office of Healthcare Affordability was created a couple of years ago, and this was under Governor Newsom's leadership. during the campaign trail, he had made some, I guess, promises around single payer. And this was, I think, his solution to that, to really look at how do we slow healthcare spending and move towards something like universal healthcare for all, knowing that California is very much going to have a very difficult time implementing a single payer healthcare system just as a state program. You need waivers, and there is pretty much no way with the federal environment right now that would be approved. And it's very difficult to provide a program that would provide some type of barriers around who and when you would be able to access such a program. You could imagine that if somebody doesn't have the ability to pay and they get diagnosed with cancer and they're in New Mexico, and then suddenly we've got everybody coming to California, as much as I would love to provide, great medical care, and I know the state can, it's difficult to be able to afford that. And so not having a national program would be very challenging. And so here was the solution here. And so this came together and again, adopted the statewide spending target. One of the things that was difficult to watch is that some of the pieces that are contributing to healthcare spending growth were lobbied out of the program because of the politics. And so one of the main things, which is pharma, is not a part of this. And the other is wages. And that is, again, a big piece of the healthcare spending, not physicians. You actually look at how much we cost the system. It's not so much here. It's more looking at some of the contract negotiations that happen and some of those commitments that come in order to maintain the broader healthcare workforce. And it puts a lot of pressure on healthcare. And that was all kind of excluded from being looked at. And so what's left was some of the other pieces that are a lot harder to control. And also, it was very much just across the board. Sort of everyone had to live within this 3.5% increase in all healthcare. So any hospital, no matter if you're drawing from a very, very big, diverse area and taking care of very sick patients, it didn't matter. This applied to you across the board. And we CMA really argued to say, there's got to be some factors that come into account there. It can't be this wide swath that's going to really negatively impact some people who are doing the right thing for our patients, and have the cost of care be higher, whether it's delay in diagnosis because of poor access, whether or not it's the social determinants of health that we all know impact the ability to take care of our patients and how much it costs to do that. So this is moving forward. It is very soon that there's the possibility that systems that are not doing this will have to pay some fines. And so just looking to see what that might look like, and trying to kind of limit the potential harm that might create. It's also set to promote high value. So looking at how to do that, and then looking at assessing for market consolidation. We know that when systems consolidate, that makes it difficult for, especially if it's a private equity or some venture capital group that's coming in and trying to pull money out and then leave the system once they've gotten the money out of the system. That is really harmful. And so there already was a lot of protections with California's Attorney General to be able to go in and look at these pieces whenever anything was being considered. So a lot felt that piece probably wasn't necessary within here, but it's there anyway. All right, so we're going to shift over to some local advocacy. And I wanted to share, I think that as pediatricians and family medicine physicians as well who take care of children, we naturally lean into advocacy. And there's really interesting looks at how much advocacy those who take care of children do. And it's very interesting. The CMA board just met for our retreat, and just in my tenure over there, have seen the number of pediatricians now on that board rise. And it's not an accident. We're seeing things that are upsetting to us. It's making it difficult for us to take care of our patients. And so we want to get in there and do something about it. And so I was very, very pleased to see 2 more pediatricians on our CMA board elected this year. And so what we want to talk about is a little bit around sort of there's 2 different pieces to advocacy. There's both kind of being an agent, and then there's being an activist. Being that agent is when you're in that one-on-one with your patient, and their asthma is not very well controlled, and so they've been in an ER, and you're following up with them, and on further review, you realize they haven't been able to purchase the aero chamber because it's too expensive, and they didn't get the controller medication because of the price. And so as an agent in that setting, we're going to go out and we're going to find the ability to get them the medication and the delivery device they need, either through a social worker or some other programs. And so we naturally do this all the time in our work. And what I want to talk about a bit more is this activist piece. And I know that can have a little bit of a negative connotation, but in this description, what I'm talking about is really just moving beyond our exam room walls and moving from that one-on-one into community and making that bigger difference. And that's why I have engaged in this work ever since medical school, is because I've seen the ability and the power that it has. And so there's so many things kind of in San Francisco that could rise up to something that's very important for us to be working on. So we talked about e-bikes. There's some supervisors that are interested in doing some local pieces there. And so partnering to design something that you feel would be effective. A number of years ago, many of us partnered with the Board of Supervisors to pass a sugar sweetened beverage tax. And what was happening, we had tried at the state level, but the big soda came in and squashed that very quickly. And so we said, all right, let's just do this on a county by county basis. And that's what happened. And, at the time in my practice, I had the data, and it showed that 30% of children in my practice were meeting the definition of childhood overweight. And we were doing everything we could in that one-on-one, talking to them about drink water and exercise, as we found out that there wasn't, I had this interaction with an 8-year-old, and I was talking to him about drinking water instead of bringing his juice boxes in his lunch. And he said, I can't, Dr. Shannon. And I said, why can't you drink water at school? And I turned to his mom, like, what's going on? And she said, no, it's right. There's not a potable working drinking fountain at his school in San Francisco. And this was probably 17, 20 years ago. And at the time, I was doing a lot of work with the American Academy of Pediatrics. And so at the end of that very busy clinic day, picked up the phone and called the executive director. And I said, this is not okay that we have not working drinking fountains in our schools here. And at the time, so this will very much age me, but it was Schwarzenegger who was the governor. So we got legislation through to require potable drinking water paid for by the state. And it was very easily signed by Schwarzenegger, who was all about physical fitness, and made it easier for our patients to not have to bring that soda can or that juice box. And so that's this example of moving beyond that sort of one-on-one agency place to this activist place of what can I do? And with that, it was really just knowing who to call. I didn't actually have to do very much in order to make that happen. And then gun violence prevention, there's always the opportunity for some of those. San Francisco's been doing a lot of work around safe injection sites and figuring out how to help substance abuse families and patients to seek services and help. And this impacts our pediatric patients very much. And so these are some of the issues that are interested, that a lot of our physicians that are doing advocacy have been very interested in. And so how to get started? There's so many things. And this is, I think, probably one of the hardest parts is you see all of the areas that need action. And so how do you decide? And this is just a handful of things. Gosh, health equity, vaccines, nutrition, seeing the changes to SNAP, climate health. I mean, just everything, right? And so how do you decide? And I talked with you about this case study. And so for me, it was just noticing sort of where I could have an impact, but also something that was affecting the majority of my patients, because that is going to give me some passion to kind of engage and go work on it. And so what I think is most important in this space is just to notice the things that get you fired up. I gave you that example for me in the exam room where I was just like mad. Like, what? Like, we here in San Francisco, with all the money that we have, don't have working drinking fountains. Like, that's just not okay. And so, really listening to those patient stories, and I encourage you, if you are interested in diving deeper into this area, to have a note on your phone where you just take these stories and you just start to notice when you're getting kind of riled up and a little bit feisty, and start documenting those patient stories. And you'll start to see a theme that comes, that you'll know, like, okay, this is sort of where I want to go. And then we'll talk about sort of then what gets in the way. Once you've identified what it is that you want to work on, there's two main pieces that get in the way of then engaging in some of that. One is we have very busy, demanding work lives. Not just our work, but just our lives, and trying to find the time to take care of ourselves and our families and all of that. And so I understand that and recognize that this isn't something that's going to be a full-time job. And so how do you weave it in? And we'll talk about that. And then the other piece that gets in the way of having success is trying to do it by yourself. And so figuring out ways to partner and collaborate, whether it is within organized medicine through the direction I've taken through AAP or the local county, San Francisco Marin Medical Society, CMA, AMA, or whether or not it's community-based work. And there's a lot of incredible community-based organizations here and at the state level that are doing really important work. And so partnering up with them can really help you to move ahead and engage in this really much more quickly. And so really just want to let you know sort of how to do this. So if you feel like, all right, I've got 5 minutes each month that I could do something kind of in this space. So what would that look like? And so here are a few ways to do it. So you can call, email, or write a letter to a decision maker, whether or not that's somebody in Congress or somebody at the state house or somebody here as a local supervisor. It really doesn't take a huge amount of time to really let them know something that's impacting their constituents. What I do to make this easy is I program their office phone numbers into my phone so that if something comes up where there's a vote that I know is happening, I don't have to go look for it. I don't have to remember who is it. And that way it just makes it very easy. The other thing you can do is sign up for action alerts through different organizations. So AAP has a very great advocacy committee that's local here to Northern California. I know many folks affiliated with UCSF are engaged in that. And so signing up to their newsletter to understand kind of where some of the actions are happening. CMA has the same thing. It's really important for all you to know, both medical students and residents have free membership to the CMA. And so if you haven't joined, I encourage you to do so and kind of get that flavor of what are the things that they're doing. If you want to, you can get engaged very in that political space. So get to know some of the elected officials or people that are running. We just actually hosted a fundraiser for Dr. Richard Pan, who's running for Congress. He's a pediatrician, and many of you know that he is a tireless advocate. He's the one who put forth the resolution that got rid of the religious exemptions for vaccines here in California and completely changed the conversations with our patients. And that was very difficult. RFK came in and actually tried to stop that at the state level. So he's already kind of been in a tussle with RFK and won. And so he's somebody that I very much am behind and working to get elected. There's nonprofit organizations that you can get engaged with that are more policy focused. There's some really interesting organizations right now that are very focused on science and electing politicians that believe in science. And so there's just some very interesting things that are occurring in that space. You can educate yourself. So sign up for podcasts or email lists that focus on healthcare issues and policy. There's one called The Daily Just Healthcare that I like. There's another one, Value Health Voices. And then KFF, it's Kaiser Foundation, Kaiser Family Foundation, which doesn't have anything to do with the Kaiser program that I'm involved with, but they do a health news piece that's really great. So a lot of times I hear folks say, I don't know what to say if I called somebody or I wanted to write a letter or an email. It's quite easy. And so I just wanted to take this and just make it very easy for you all so it doesn't feel intimidating. I remember the first few times I did this, it felt very intimidating. And it's not. Usually you pick up the phone and it's a staff person, and all you do is you introduce yourself always as doctor. If you're not a doctor yet, doctor in training. And because that carries a lot of significance in that space. And then if you're a voter or a constituent, make sure that you bring that forward. You know, I am a voter in San Francisco. I'm calling about that e-bike legislation, really want an I vote or a yes vote from you. This is incredibly important. You know, a month ago, saw somebody in our emergency room who unnecessarily had injuries because we're not regulating this for our teenage patients. And then give your phone number, offer to be a resource. Is there any other information you need from me? Are there some statistics that would be helpful? Would you like some patient stories? I'm here if you need me. Done. So, and you can do that on any different topic that you have. All right. So say you feel like, all right, I can do a little more. And so you have about an hour a month. So join a local advocacy committee. Actually write to somebody or draft an op-ed letter. There is a lot in the paper right now related to healthcare. And so just having a couple very short letters that are ready on specific topics, because you kind of know what's going to come. You know, we're talking about the ACA and subsidies, talking about work requirements, we're talking about access to care. And so just sort of penning a couple things on the things you care about so that when you see something come through, you can send it right away, because it needs to go within usually like 1 to 2 days of when that article got posted. Can attend different community forums or events, especially ones that are being hosted by decision makers. You can cultivate long-term relationships with public officials or decision makers in your community to try to be a resource to help to guide some of the policy. You can provide testimony. There's different events also in the media that you can start to do. The other is just to get more awareness on the thing that you care about. And so penning something, an article on an advocacy issue you care about, and then submitting that to the AAP local chapter or to the County Medical Society. Some of our alma mater newsletters are always interested in reading about some of the things that we care about. And then if you have a few more hours, then you can move more into that higher level. So moving to be on a board, offering medical expertise in the community to local organizations, schools, institutions, working on some type of community project in partnership and in coalition with others. You can drive up to Sacramento, that you have, and testify on local issues. And then you can also become a delegate to different policymaking bodies, so CMA, AMA, AAP, and then just join different councils and committees. And if any of you are at all interested, my email will be at the end. And I encourage anyone to email me, let me know what issues you care about, and I will plug you in. And if I don't know, I will find somebody who does. And then just remember to vote. We just talked about the implications of all of that. We're going to have some important elections coming both June and November. And so who are the organizations to partner with? We've already talked about this, but federally, all of our specialty organizations, National AAP, AMA does work there, state level, CMA, as well as our specialty AAP, California, and then locally, lots of different community organizations, and then our county medical society, so San Francisco Marin. And then this is just a huge list. I'm not going to read all this, but this is different ways to engage in CMA. So so many ways. You can join the board, you can join a forum, you can join a committee, there's councils. So lots of different ways to get involved. And this is just a lovely quote from one of my colleagues at Permanente here in San Francisco, and she's on the Wu Yi Children's Services Board, and just talked about how it's been a great opportunity to stay connected in early childhood education and development and align her clinical practice while also giving me the opportunity to have direct impact on the local community. It's giving her the ability to cultivate new skills as a leader, meet new peers for networking, professionals, and community and thought leaders, and to stretch her intellectual and emotional muscles in new ways. And she really enjoys that connection into that local community. So I'm going to pause. I would love to hear sort of what organizations have you or are you working with? And please drop into the chat some of the ones, because I think it's really inspiring to hear what people are engaging in.
Hey, I'm Michelle. I'm a second-year peds resident here. One of the, I guess, like the main place that my politics and advocacy lives right now is with our union. Mm-hmm. And I noticed that physicians unions are small, but I'm also curious to hear your take on like physician organizing. But like for me, within the union, not only do I feel like I'm advocating for residents' rights, like in our hospital, but I feel that it's really important to kind of unite as a working class as a whole. So like partnering with other unions, raising the standards. To me, that kind of lends to how do we fight back against like fascism, authoritarianism, our billionaire elite class, like that sort of thing. But then more specifically, the union, we are working to put protections in our contract that support like making the boarding crisis in the ED better, protecting residents and patients against ICE raids and things like that. And so the union is pretty far reaching for me. And in thinking about moving towards being an attending, it makes me nervous because unionized physician like attending roles are a lot less common. And but anyways, that's what I do.
Thank you for sharing.
Long-winded, sorry.
I'll circle back to some thoughts about unions, but I wanted to hear from others about how you're engaging.
Hi, I'm Elizabeth Ozer. I actually have a question for you.
Oh, okay.
So I can wait.
No, it's fine. Actually, let's go with questions. Okay. I think that this was the end of it. I'll just close. Really what I want hopefully to have inspired in you is find your passion and join with others in that passion. Get involved in civic engagement, vote, follow politics. And with policy, get engaged, figure out how to move it towards the things you care about. Get involved with your local county medical society. As I told you, your resident dues are free. So it's a really great time to engage. Their medical society is very, very open and welcoming to everything that residents are interested in. Get engaged with your specialty association. And then this is my email, just Shannon.Udovic-Constant at kp.org. So reach out if there's any ways that you're interested in discussing kind of what you love and what you care about. I'd love to help you get connected. And just, this is the benefits of advocacy. It offers an antidote to cynicism. It helps me, especially this last year when so much was coming at our profession and our patients. It was nice to have a place to engage and feel like I was doing something. It shows strength in numbers, and it renews this commitment to why we chose this amazing profession, taking care of our kids. And so just leave that up and let's engage in conversation.
Well, first of all, thank you so much for this great presentation and even more so the work that you've been doing.
You're welcome.
So a couple questions, thoughts just came to mind. One was more specific, interested in hearing a little more about where some of the California state level, and you talked about AI. Mm-hmm. You gave an example of scribes, mm-hmm. but I was wondering just if you could talk a little more about the work and if it's broader or it's focused specifically on certain areas. So that would be wonderful. Mm-hmm. And then my other thought was, you talked about this advocacy, talked about congressional races. I'm wondering on the state level, clearly we have a big governor's race.
Mm-hmm.
This is a really important time where the candidates are shaping their areas and what they're going to really say they're going to lead on. And I wondered about that, about both the organization's engagement with that, as well as this seems like a prime time to have them really highlight some of these areas. So that was also a thought about our statewide race.
Yeah, perfect. So we'll talk about AI, we'll talk about the governor's race, and I'm going to circle back to unions, and then we'll open up to the rest of the questions. Awesome. So AI is an interesting space. So where CMA has been focused, and this has been really important as an officer of the organization, which is we have to focus and prioritize where we spend our energy and our efforts. And sometimes that's difficult because there's so many things. And so in this AI space, there's a lot of people that are engaging in work groups and conversations with broader groups. But in terms of where we're leading, it's mostly on things that are important for our profession to kind of put some guardrails around it. So the last session was around making sure that there's disclosure when AI is being used, and you've got like a chat bot interacting with you that's pretending to be a doctor, like to have so that passed last session to say, no, you've got to disclose that this is a chat bot and this is not your physician providing this advice. Not to say that we can't have some AI generated responses that then we oversee, edit, and send under our name. That's very different, right? Versus something that's pretending to be us. So full disclosure and transparency about where AI is being used was last year. This year, I just kind of told you what the priority is. There's a lot around that's really broad that impacts healthcare. That's more in the business community that we're trying to make sure there aren't unintended either harm or consequences to the way we practice. There's also, you probably heard, there's another state that just passed legislation to allow kind of AI to do automatic authorizations for medications. So we're just very much looking at that and making sure that, again, there likely are places where that's okay, as long as it's under a protocol. I know within my organization, we already have pharmacists that are doing a lot of things under protocols from physicians that don't require me to be in it every single place. And so again, use it, offload us, but make sure those guardrails are there for safety. So that's kind of the AI piece. The governor's race, yes, it's like you just knew what we're doing. So CMA just endorsed Congressman Eric Swalwell Tuesday. And the CMA only started to engage in the governor's race for the first time 8 years ago, recognizing how much influence that position has over healthcare. And so I was on the board at that time. It's a little different in terms of the politics because it was the polls were more clear about who was going to be the front runner. And this race has been interesting to say the least. But our executive committee and our board has met with all the candidates and decided that for healthcare, that Congressman Swalwell would be the right partner. And a few reasons for that. I think one is that he has some ideas that will help the economics of the state so that there isn't the pressures on his budget to pull from healthcare, because that's what's been happening. And then also his relationships in Congress, and kind of fingers crossed that the midterms will turn out in a way that will have more influence from California. He has all those relationships that really could help us make the adjustments we need to HR1 and the Affordable Care Act piece. So those are some of the reasons. I'm happy to talk offline with others if you'd like to. And then with the union piece, it's complicated for me, and this is just my own thoughts on it. I completely understand the benefits for residency. There's not as much ability to negotiate, right, in a residency program. I think one of the things that I talk about with many of my colleagues that are very fired up about unionizing at the attending level is one of my cautions is one of our strengths as physicians in all of this work is our brand. And our brand is that we show up and do the right thing for our patients. And if we move into this unionizing space, it gets tricky because then it looks like we're a trade. And although some of the pieces that are important often line up with what's best for our patients and what's best for us, it's not always the case. And if we're in some of these rooms and it looks like we're leading with what's best for us, we potentially are losing that brand that I think has carried us very, very well. So it's a caution. And one of my big pieces here is, as I've traveled across the country talking to doctors, physicians have not kept their power. And I think there's other ways that we can get our power and bring our power back that isn't around unionization. It's around proper signing of contracts, knowing what's in your contract and saying no to contracts that are bad. This isn't collective bargaining. This is just knowing what is your contract. And so many people that are unhappy, when I ask them about the logistics of their contracts, they didn't even know. And so CMA has done so much work in this space. We have sample contracts. They're free to members. And so let's go out and take that power back in the way we can, raise our voices, within systems where things aren't right for our patients. And I feel we can do that without moving towards that unionization. There's some that disagree with me, and we'll see where that conversation goes. But I think we have some opportunity that we haven't really taken care of. And the other piece is that our CEO for CMA makes the joke that everyone in healthcare is making money except for the doctors. And I think some of it's tongue in cheek in many ways. I think, yes, we're pediatricians and that's not why we signed up for this job. And yet I'm very comfortable in my financial situation. And I think also just having work that's meaningful carries so much value. And so how do we bring the joy back? How do we get back to taking care of our patients, getting rid of all these administrative burdens, and really getting back to delivering care for our patients without all these other hurdles? And how do we use the healthcare team to do that? And I don't think we fully maximized even in that space, where we partner. And sometimes the doctors are the worst. I had to relearn, how I trust. Medical training is one by one by one. I am responsible. And yeah, we got a team, but it's still in the end, did you check that lab? And it's very focused on that. And then you get out into practice and you've got to lean on your team. I got to turn stuff over to my nurse. I got to turn stuff over to my medical assistant to make decisions on my behalf and trust that she's going to do it right. Because I got to be free to do the doctoring. And so how do we really work within that system to make the profession what we want it?
I'm Charlie Irwin. I'm a retired professor here at UCSF and been very involved in adolescent medicine.
Yes.
And I sit on two really interesting committees. One is the Committee on Pediatric Research that's associated with the AAP. And we meet in Washington twice a year to talk with our representatives. And what is clear to me that data doesn't drive any decision making. And if you think it does, it's just not there. I had the bad luck of having two cousins with cystic fibrosis. Mm-hmm. And when I told our senator that, today those kids don't die, but I watched two of my cousins die. And she was, oh, I didn't realize that, So I think the storytelling is really important. So writing down stories, telling the story and telling, what you're doing to help. I also sit on the advocacy committee for the American Pediatric Society, and we do similar things, but it's more focused on research within the APS. So they're two important organizations that as residents, faculty, that one should really get engaged with.
Thank you for your service. Absolutely. Advocacy, often what moves people to act is the emotion. It's the heart. We have to have the facts to give to them too, but it absolutely is the heart that moves people's decisions.
100% want to endorse that too. We are seeing that a lot with medical misinformation, right?
Yeah.
It's all about the stories. I want to echo Elizabeth's appreciation earlier of all the amazing work you've done over the decades. Thank you so much. Two quick things. One, I think everybody in this room can be an advocate for making sure that we maintain our pediatric workforce. Probably most people in this room are aware that we are facing very significant shortages across the country, particularly in underserved areas like more rural areas. And so that is absolutely an access issue. It's an equity issue, and it is a looming issue that's already here and is going to be worse over the decades. So anytime you have the opportunity to talk up how great it is to be in pediatrics, do it. And we need pediatric subspecialists. We need generalists. So I'm working on one of the AMSPEDEC committees on this. I'm obviously not a department chair, but if people want to get involved, let me know. And then this is a very particular question, but when you were talking about all the ways to reach out about any variety of issues via telephone calls, emails, letters, signing petitions, do you have any sense of the pecking order about like the bang for the buck? Because sometimes you'll get like, this is the boilerplate letter. Like, how much do we have to change the letter, or can we just sign the letter? I don't know how much you know about that, but that.
Yeah, no, it's a great question. I do know. Actually, phone calls are best. They recognize that it takes a little more effort, but I hope that you see that it doesn't take a lot of effort. But that, especially for if you're a constituent. So if you're a constituent, picking up the phone and calling that local or state office and saying, I am a voter from your area, they'll ask you, they'll like, what's your zip code? So that matters a lot. And it's crazy how few calls it takes to get them to go, this is something people care about in my area. So 10 to 15 is literally like what I've been told it can take because there's just not a lot of people engaged. So the phone call, if you're doing more of a responding to an action alert, sort of a statewide, or, it's something more broad, I think just signing that letter, I just make sure that it has my title at the bottom, doctor. But otherwise I don't put anything unless I know it's going to somebody that I know, then I might just say, thanks for the work you've done on XYZ issue. Maybe it gets some notice, but if it's just one of those form letters, it's fine to just send that. Because then again, they're kind of just counting how many are coming through.
So we had a couple of online, not questions. Anda, which you probably know, she's active in Children Now, the AP, and the California Advocacy Training Collaborative. And then another writer, Sarah Ismail. I'm not a physician, but I do have an MPH and participated in a group called the Public Health Justice Collective. Most of us were Berkeley and SF State MPH grads, and we would meet every couple of weeks, got into small teams to work on priority topics, and would attend local council meetings and offer expertise as public health experts to advocate for public health impacts of things such as sanctuary cities.
Great. Thank you for the work you're doing. I think we had a question over here.
Hi, thank you so much. It's so nice to see you.
Lovely to see you.
And I'm going to have to echo one more time. Like when I talk about career development to trainees, I'm like, you are the person I point to as like somebody who does really amazing advocacy and is also a working pediatrician. So thank you for all the work that you do. So climate change to me is like this massive threat, right? Of all the threats that are coming down the pike. So, and I'm on the AP Chapter 1, I'm co-chair of the climate committee for them. And so one of the things that we've been talking about in our committee, and it'd be helpful to get your thoughts on, is thinking about bills to prioritize that don't say children, that don't say this public health that is going to impact the, kids in this direct way, but also think about things that like have climate, increased carbon emissions, drive climate change that don't have children necessarily in them, but actually might have major ramifications. So how much, like, do you guys talk about that in CMA, and how might you kind of frame that? No, I'm just saying, like, as the AP, normally we look for things like when you look at bills to prioritize, you're like, what are the ones that affect that have children in it? Lead
I think going
poisoning,
more
blah, blah, blah,
broadly.
e-bike,
Yeah.
as opposed to thinking way upstream, which is what could have major impacts for child health, even though it doesn't say children in it.
Yeah. No, I think the climate health issue is very interesting. There's so many physicians that feel very passionately about it. And CMA has hundreds of policy positions on it. And so where I've counseled a lot of people, or you and Lisa Patel and Ashley McClure, and I mean, there's so many incredible advocates working in this space. And it feels like where you're going to have the biggest impact is to partner with a really big organization that has more money, and give the stories that are the healthcare stories, and the credibility as the physician about how these things are impacting health. Because I just think, to your point, it's hard to get enough attention in that space, if we're just talking about how it impacts kids, sadly, because the voters that understand that, and when you've got kind of some competing business interests that are big, you've got to be more strategic. And so I would look to, some of these other organizations, Climate Now, and some of these other bigger groups, and get a planning committee with them about, hey, we've got a whole bunch of doctors that really care about this. How can we partner with you and use the stories when you need them, to move the votes?
And CMA doesn't ever prioritize something that is like not obviously healthcare, but might have serious healthcare effects.
CMA has been so focused on making sure physicians are getting paid, whether it's like Medicare reimbursement or Medi-Cal money. And then, just all this issue around Medicaid access to care right now. It's not that the organization doesn't care about it. It's that there's got to be this finite focus. And so it hasn't made it onto a priority list. It's not because it's not important. But what I remind everybody is that, if you're moving into that space, check the policy compendium, because if CMA has policy on it, then you get CMA's name onto your thing that says this is, CMA endorses. And then it gives you that bigger lens. So happy to partner with you and let you know where we have policy to help you to kind of choose where to focus. But I think that just because the impact to business is so big often with these things, you've got to have some associations that have a lot more money to kind of make those relationships. It's kind of the yucky part about the politics, but it's the reality. So.
Well, we're 3 minutes over, and I officially got handed the mic by Roberta. So we're going to say thank you.
Thank you. Thanks for coming. Thanks for everything you guys do on behalf of kids.